Hey everyone, this is Eric Christensen, Pharmacist from meded101.com. I'm going to cover some important things you should know about the Ambulatory Care Certification exam in 2026. So first and foremost, three big changes, just a broad overview here. So one thing that's a little unique, they're changing testing centers. I believe it was Prometric before, and now they're going to go to Pearson VUE. So if you're, looking in the late 2025 time frame to schedule that, and there's some confusion there, be aware of that and pay attention to that when you're scheduling your exam. Hopefully it's all resolved if you're taking it a little later in 2026, but just wanted to point that out. Content outline changes. So these are active as far as the date of October 1st, 2025. So I'll go through that coming up here. And one of the biggest good news things associated with board certification exams, any exam that's in the continuous giving phase, which is the overwhelming majority, you will actually get immediate results after you take that exam. So I love this. It's great to know. If you find, that you didn't pass, which, there's a significant chunk of pharmacists that don't, it's okay. Pay attention. And I would recommend, going back, grabbing a notebook, whatever, your laptop, and I would take some notes on topic areas that you need to brush up on where you did not feel comfortable with answering the questions. That's what I would do right away. If you see that you didn't pass, take a couple deep breaths and go back, take some notes so you know how to better prepare yourself and can help identify some weaknesses potentially in your study game. All right, so let's go through previous results. So I just want to say historically, the ambulatory care exam has usually been in the 60s, sometimes low 70% as far as the pass rate. I will say whenever content outlines have changed, I've followed this for probably a decade now, over a decade. When content outlines change, typically the pass rates do go down. So I can't promise you that will happen. Maybe it won't. But historically, that is what I have seen. So unfortunately, 2025 is not available yet. I put this together in late 2025. With that said, hopefully pass rates should come out in 2026, and maybe I'll do an update then. But I would anticipate going into 2026 that those pass rates may be a little bit lower for the 2026 year. So again, historically, pass rates in the 60% range, sometimes bumping up to 70 here. But I would anticipate that would go down. So I'll be keeping tabs on that and paying attention to that. But bottom line, it is a difficult exam. Take your time to prepare. Make sure you're ready to take the exam when it comes time to do so. And hopefully you'll be one of the ones that pass the first time. And now you're going to know right away. You won't have to wait a month, 2 months to get your results. So that's a good thing for sure. This is a question I always get. Can I, usually it's a pharmacist that, graduated, they've been out a year or two in practice. Maybe they don't have a residency and they want to take the ambulatory care exam. So the requirements are you need at least 4 years of ambulatory care practice experience after licensure. Okay, so that's one thing to remember. With at least 50% of time spent in the scope defined by the exam content outline. A lot of people get tripped up or confused about that. Do I qualify? Do I not qualify? Do I spend 50% of my time? I have not seen a pharmacist rejected yet, as long as they have the letter of attestation from the employer, which is required basically to ensure that you have 4 years experience with at least 50% of your time. If you get that letter from your employer, which most employers are very ready and willing to approve that if they've got a pharmacist that's going above and beyond and trying to educate themselves further. I have not seen that be too much of an issue with employers, or at least that's my experience. The other way successful completion of a PGY1 plus 2 years of practice after licensure. And then the third way is a PGY2 in ambulatory care pharmacy. So if you want your absolute quickest way following graduation to take this exam, it would be doing a PGY1 and a PGY2. I would say the majority typically have, PGY1 or they've been out in practice for a little while and that type of thing. But certainly there are plenty of PGY2s out there as well. So about the exam, mentioned that content outline changed. The biggest thing I would say, I went through line by line, looked at it. The terminology got more vague in the newer content outline, which presents a little bit more of a challenge in trying to create study materials. But I am happy about this change. The patient-centered ambulatory care went up. That percentage of the exam went up a little bit. So it's up to 79%, where historically it was 75%. And the professional practice, which historically was composed of translation of evidence into ambulatory care practice and ambulatory care practice advancement, that used to be 25%. And now it's all lumped together. So there's only two domains. It's patient-centered ambulatory care and professional practice. Again, I alluded to the fact it is less specific than the previous content outline. So we absolutely did our best to pull terminology, education, those type of things. With our study materials at MedEd 101, I would say, pay attention to that regulatory PDF. We did do some changes on that to try to align a little bit more closely with the newer content outline. But again, I am happy about the increase in patient-centered ambulatory care. Other things about the exams, frequently asked questions. It is generic names only, so there's no brand names on there. I think that helps alleviate that question, hopefully, for you. Labs are typically not going to be provided, so you better understand the basics for sure. Creatinine, GFR, hemoglobin, potassium, some of the other electrolytes maybe. You better have a good sense of where normal levels are. TSH, another good example. Better have an understanding of where those normal limits are so you can help identify a potential concern or issue when you're presented a patient case that provides some lab values. It is 150 questions, so this dropped several years ago now. It was 200, and then it was 175, and now we're at 150. An important note about that, 25 questions are not scored. So don't get too stressed if you get a few wrong early. You really don't know if those questions are scored or not. They might be, but they also might be a part of the new questions that the committee is sampling. The majority of questions, multiple choice, one answer with 4 possible choices. Timing, 3 hours, 45 seconds. This is really, really important when you're doing practice questions. Pay attention to how long it takes you to do those questions, okay? And hopefully you kind of know if you're a slow test taker, fast test taker. That can certainly be helpful. If it's been a while since you've taken an exam, you definitely want to pay attention to how long it's taking you to get through practice quizzes, practice exams, and practice questions. All right, so let's break down that content outline, patient-centered ambulatory care. This is 79% of the exam, or approximately 119 questions. This is huge. Obviously, there's tons of topic areas that could be covered within this exam. When you're kind of devising your plan, if you're using our study materials, certainly you can see the disease states that we cover that we think are really important, some of the big, broad ones. If you're kind of going it solo and going it on your own, think about the really, really big disease states that are commonly occurring in ambulatory care practice. Diabetes, asthma, COPD, depression, cardiovascular concerns, pain management, Other psychiatric concerns maybe can crop up a little bit too frequently. So think about those disease states. Give yourself a good background, and I would say focus on those areas where you're weakest. Okay, so if you work in a diabetes care clinic, I wouldn't spend a ton of time on diabetes. You probably know that stuff inside and out. Same thing if you work in a psychiatric clinic for your primary care, for example. If that's what you mostly see, odds are likely you're probably pretty well up to speed within that area. If you're working in more of a community retail role, you might want to do a little deeper dive into some of the clinical things. As far as, lab monitoring and adjusting doses and some of those things. So definitely can vary a little bit. Make sure you're up to date with guidelines. And there's really two simple concepts if you're getting overwhelmed that I go back to is understand why you would select a medication and why you wouldn't. So, great example of that is, this is guideline-based therapy. This is first-line choice. That's why you would select this medication. Why you wouldn't? Well, they have, an allergy to this medication, or, they have a significant seizure history and, providers asking if we should start bupropion, for example. Well, that can increase the risk of seizures, so it's like that's a medication we'd probably want to avoid. So that's a reason you wouldn't use that medication for managing depression. So that's, really my mindset when I've taken these type of exams is to, think about as you're studying why you would and why you wouldn't select a specific medication. All right, so be prepared to analyze case scenarios. Typically, they're fairly brief on the BPS exams. Occasionally, they might get a little bit longer. Again, that drug selection, contraindications, warnings, compelling indications, guidelines, adverse effect profiles, monitoring parameters, significant or major drug interactions, and then, rarely may look at some genetic considerations as well, pharmacogenomics, for example. I typically don't advise focusing too heavy on dosing. The example I bring up is, let's say you've got, a dose of gabapentin. They're unlikely to ask you what the max dose of gabapentin is, as just a straight up question. But if you've got different disease states, for example, or like a good example is anticoagulation. Are we talking about, prophylaxis? Are we talking about atrial fibrillation? Knowing and understanding those dosages is important, I think. If you've got boxed warnings, that's another good example. If you've got a boxed warning on a medication about going above a certain threshold in a certain type of patient population, again, another example there where it's like, yeah, you might want to make sure you commit that to memory. Patient-centered ambulatory care is not just drugs, while I think the overwhelming majority of questions will be. There's some preventative care type things in there. Educational barriers and, patient education, those type of things, patient engagement, lifestyle, interviewing techniques, motivational interviewing, things of that nature, patient adherence, recognizing that in a case scenario that may be an issue. So there's definitely plenty of other things that can kind of fall under this umbrella. And it's, not 100% of that section is about medications. So keep that in mind, and that you're probably going to see some of these type of situations as well. All right, so the professional practice side of things. So this is your statistics, your study design, your literature evaluation, population health, medication safety, pharmacoeconomic principles, and then practice standards and regulations. So again, I've got a ton of this stuff in the separate PDFs, that things that commonly come up on these exams and things. So definitely a great place to start there if you're looking for information to help you prepare for this section. Strongly recommend you taking the time to get through those PDFs in the All Access Study Package. In our study materials, if you want to pause and take a peek, you certainly can. These are the topics that were updated for 2026. Right now, we've got well over 20 hours of video review course within our study materials. Again, I alluded to some of those updates on the previous slide. We've got over 1,000 slides, PDF that's downloadable as online question bank. We've got a couple of 150 question practice exams that are downloadable as well. And again, I tried to stick to that BCACP exam format on that. The statistics, professional practice, regulatory study guide, that you'll see within the downloadable options as well, some comparison tables. And this all access package, you can purchase it for 6 months or you can purchase it for a year. And then if you've got study materials from, another organization or somewhere else that you like, that you're happy with, and you really want access to more questions, try to get a feel for, what the exam looks or feels like, we do have a question bank only option as well. So feel free to check that out at meded101.com/store as well. Do have plenty of testimonials for the pharmacist board certification exams. We've helped literally thousands of customers and absolutely have tried to improve the study materials every year since I first started doing this in 2015. I mean, it's been a decade now that we've been, trying to continue to get better. Obviously, we receive feedback periodically where it's like, hey, your study materials didn't cover this topic at all. Where was that? So we try to listen to that, of course. And then, new guidelines, new drugs, new things come up. And so we update certain sections based upon that as well. And here's just a few more testimonials from the past as well. So if you're interested in study materials, meded101.com/store, they are available. They are up to date for 2026 for the entire year. We update them annually. So again, that link, meded101.com/store, I'll put it in the comments too. If you have any questions about eligibility or what to do in certain situations, I do get a lot of emails on that. So I do my best to help guide people to the appropriate place or help them in whatever way I can. So feel free to shoot me an email, mededucation101@gmail.com. Thanks so much for listening. Hopefully this helps you prepare for your ambulatory care exam in 2026.